First of all, I'm London Breed, Mayor of San Francisco, and I want to thank all the people who are here with us today to talk about safe consumption services in San Francisco. Let me start by thanking Glide. Just last year, in the same space that we are in, Glide hosted a mock-up of what a safe consumption space could look like in San Francisco, and how it could potentially be an incredible service where it could save lives. And the fact is, I think the challenge that we face in the city and actually throughout this country is not having an honest conversation about people who struggle with substance use disorder. And we know that it's happening and playing itself out on our streets, and people are complaining about it. But the fact is, complaining about it and moving people from space to space to space does not solve the problem. If anybody has had a family member or their own personal experience with substance use disorder, you know it's just not that simple to say, here's help, or here's support, or here are services, you have to get better. People who suffer with substance use disorder have real challenges. And I think we have to change the kinds of services that we provide to help people who deal with those challenges. We've been lucky in San Francisco that we have had incredible partners and people who have led the way, including the AIDS Foundation and Delancey Street Foundation, Health Right 360, formerly Walden House, and Haight-Ashbury Free Clinic, all these great institutions that put themselves on the line to work with people who are struggling. And what's so amazing about the work that they've done, they've helped people get out of the addiction that they have and back into living full, productive lives. That's what all of us want out of a program like this. And so today, we are here to announce what we are going to be providing in legislation. Myself, along with Supervisor Matt Haney, will be introducing legislation to begin the process to issue permits to nonprofit agencies to open safe consumption services in San Francisco. And you all know I've been working on this for years, even when I was on the Board of Supervisors, and expressing and trying to help to, inform people about what this actually means, what this could mean. And let me just talk a little bit about what it can mean, and I'll introduce Supervisor Haney in just a moment. But the fact is, think about it. You see people who are basically out on the streets injecting publicly. You see people who are using the foil and the system to use fentanyl and other things that are out there. And just think about it. Just imagine them walking through this door and getting a space where they're doing it inside, where it's contained, where they're around people who basically are treating them with respect and making it clear to them that as soon as they are ready, we are there to help them. That's what this is about. When they are ready, when they say the word, they're getting the counseling and the services, and they are immediately provided the treatment that they need to get healthy. They're not just going to do it because we say to do it. They're going to do it when provided an opportunity that they feel safe, that they feel comfortable, that they feel welcome, that they feel that they can trust the environment and the people that they're working with. This is about not just the conditions that we are tired of seeing out on our streets. This is about saving people's lives. The people out there are someone's mother, somebody's father, somebody's brother, somebody's cousin, somebody's uncle. They have family members, but they are struggling. And this is just a way that I think this is a direction we need to move in. Things are changing. What people are using changing. We know the history, the crack epidemic in the 80s, the heroin epidemic, and now back, the opioids in general, like what's happening and the trends around certain drugs and what happens. So we need to make some adjustments to deal with those challenges so that we can get people the help and the support that they need. And that's what this is about. And so as we know, with all the challenges that exist with the federal government and the concerns, we know that those concerns are real. We want to make sure that we protect the workers who are going to be on the front lines doing the work, the city employees and others who are putting themselves on the line to help other people get the help and the support that they need. We want to make sure that the city is being responsible in how we set up the permitting process to provide support to these agencies who are preparing to do this work. So this is just one step to get prepared for what we're hoping could be an opportunity to open a safe consumption space in San Francisco soon. So thank you all so much for being here, and at this time I want to introduce Supervisor Matt Haney.
Thank you, Mayor Breed. I just first want to recognize and acknowledge your leadership, your steadfast leadership for overdose prevention sites or safe consumption sites. Mayor Breed, when she was a supervisor, as she said, actually started the task force that looked into this issue, that analyzed these sites in other parts of the country and other parts of the world, really, and came forward with a set of recommendations that this is something that we had to do here in San Francisco. And so it was because of her leadership, both as a supervisor and as mayor, that we're standing here today introducing this legislation. It's also because of the leadership of folks who do heroic work every single day to save lives on our streets, to provide care and outreach to folks who are experiencing substance use disorders. And those folks, I think, also deserve a great debt of gratitude for what they do every day and for what they did to get us to this point. I want to acknowledge GLIDE, the San Francisco AIDS Foundation, the DOPE Project, HR 360, RTI, everyone who has been a part of this movement to deal with this crisis, this epidemic, in a way that is evidence-based, that is compassionate, that is effective, and that will save lives in our city. We are facing right now the most deadly epidemic that this city has seen in a long time, and that is drug overdoses. This past year, in 2019, there were over 330 deaths as a result of drug overdoses in San Francisco. That is a massive increase over 2018, and actually the number is expected to go up even higher than that. You can walk around this neighborhood and the neighborhoods that I represent and see people who are struggling, see people who are suffering, in need of care, in need of support, in need of outreach and treatment, and above all, need a place to be able to be inside to make sure that they can live and survive and have people who are there for them. We know that overdose prevention sites are not a radical idea. There are over 100 that operate in 65 cities all over the world. And in those overdose prevention sites, not a single person has died of an overdose. Thousands of people have been able to enter treatment and care. That is what we know that we need here in San Francisco. We also know that this will actually save money. The task force and the report that came out that Mayor Breed was so involved in championing showed that actually each overdose prevention site will save the city approximately $3.5 million in healthcare costs. So this is the right thing to do. It's the smart thing to do. It's the compassionate, effective thing to do. And it could not be more urgent for us right now as we face this most deadly epidemic. This legislation would provide a process, a permitting process, so that healthcare professionals can prepare to open one of these sites as soon as possible. We don't know what the federal government is going to do, but we know that they don't know, especially this federal government, doesn't know what's right for San Francisco. We in this room, the professionals who are doing this work, the mayor, the board of supervisors, the community, know what's right for San Francisco, and what's right is for us to move forward with these sites now. We were able to, just this past week, get positive news in Philadelphia, where they have been in federal court and have won again and again, and they are going to be moving forward. It's time that San Francisco move forward as well. So we are going to be introducing this legislation together. next Tuesday. We are going to be continuing to push for the state and the federal authority to do this, but what we need to do is move forward and prepare and do our part to be ready at that moment as soon as possible to open one of these sites, because it's urgent, it's devastating our community, it's deadly, and we know that this is a huge part of the solution. It's not the only solution. We also need to do a lot more than this, but it is a part and it's a proven tool that works. I also want to acknowledge Andres Powers and his partnership, and Abby Rivermonte Mesa from my office. We've been working collaboratively on this for months, and this is a moment for action, and that's what we're doing here today. Thank you all for being here.
Thank you. When this idea of doing a safe injection site, now safe consumption services, did I get it right? All right. When it first was brought to my attention, it was brought to my attention by Laura Thomas of the Drug Policy Alliance. She had spent so much time advocating and talking to elected officials, working with the community. She provided opportunities for people like me and others to visit Vancouver to get a firsthand experience to understand what this could actually mean and how this could actually work. And there's nothing like seeing it directly to really get an understanding and seeing it in use as to how it could potentially help people. And I think I was on board before that trip, but I was more determined to get this done here in San Francisco after that trip. And it's because of Laura Thomas and her leadership. She's now with the San Francisco AIDS Foundation, and so let's welcome Laura Thomas.
Yes, so I'm Laura Thomas, Director of Harm Reduction Policy at the San Francisco AIDS Foundation. And as the mayor said, I've been talking to people about this for a very long time. But I'm really grateful for the leadership of the mayor in particular, both when she was on the Board of Supervisors, as you've heard, and now as mayor, for her willingness to stand up and say this is the right thing to do. And I'm also really grateful for the leadership of Supervisor Matt Haney, who stepped forward and said, what can we do about this? Let's do something now, and has brought a sense of urgency around the overdose crisis to this issue as well. So I'm really grateful to both of them for their leadership on this issue. And I also want to say thank you to Glide for hosting us here. Many of us were here for the Safer Inside demonstration project that they put on that I think was really transformative for people who weren't able to travel to Vancouver as the mayor did, but were able to come here and see what this would look like, what the concrete reality was. And I think that was really a transformational public education effort, and I'm grateful to Glide for that. I also want to thank the leadership that we've had from people who use drugs throughout this entire process. You know, this first came up from people who use drugs. They've continued to be involved in in shaping the Safer Inside, in showing up at the Health Commission and the Board of Supervisors to testify in support of this. And what we've heard over and over and over from people who use drugs is, we do not want to be injecting on the streets in public view. We want a place where we can be safe, where we can be welcomed, treated with compassion, and where we can be indoors and able to be out of public view. We don't want people seeing us out there. And I think that's important for us to remember as we think about this. You know, these are programs that can provide a bit of respite and dignity and compassion for people who often don't experience that in their day-to-day lives. I think it's very clear that San Francisco needs these programs. When you look at the amount of public drug use that is happening, we need these programs. As you've heard, these would save money, save taxpayer dollars. They've been shown over and over again to increase the number of people who go into treatment or are connected to other services, to reduce public drug use, to reduce syringe litter, They do not increase crime in the area. They don't increase drug sales in the area. That's been shown over and over again by research in multiple different countries, and I think it's very clear from the scope of the overdose deaths here that we also need these services. I think it's also clear that San Francisco wants these services. You know, the San Francisco Chamber of Commerce, Dignity, City Beat poll has repeatedly shown that well over 3/4 of people polled support these services here. And the state bill, AB 362, has gotten support not only from the Chamber of Commerce, but San Francisco Travel and other groups that see just how useful these sites could be for us here in San Francisco. And finally, I think San Francisco deserves these sites. We've long been on the front, on the cutting edge of following where the science leads, following where compassion leads us in order to do the right thing, even in the face of federal opposition. We know how to do these things here in San Francisco. We know how to do them well. And so I'm excited for us to be moving forward as a city, and I am excited about having the leadership in this legislation. We still need to get our state bill passed, and we certainly face challenges with this federal administration, but I'm confident that we have the leadership and the will and the moral wherewithal to make these happen here in San Francisco. Thank you.
Thank you. So I also want to just take this opportunity to acknowledge and thank the Director of the Department of Public Health, Dr. Grant Colfax, and the Department of Mental Health Services, Dr. Nagusa Bland, two folks in the Department of Public Health who are helping to spearhead this particular process and are very supportive of this next step. They have been just invaluable throughout this process, and I want to thank the Department of Public Health and its staff for their work and their willingness to do whatever it takes to help us get to this place. So as I said, we plan to introduce this legislation next week with the goal to prepare so that when we have the opportunity to open one of these sites, we want to be ready on day one. And so again, I'd like to thank Supervisor Haney for his leadership in helping to move this through the process, as well as so many of the folks who are here standing behind me who have been doing this work for many, many years. They are the people on the front line working with folks who are struggling with substance use disorder every single day, and their compassion and their love for the clients that they serve is extraordinary and has led to so many incredible breakthroughs in people's lives. And that's what this is all about, having a breakthrough so that we can save people who are struggling. And I want to thank all of you for being here today, looking forward to the day when we're able to really get this program going once and for all. So thank you all so much.